Our next presentation, and it's the presentation that's going to take us right to lunch, is also going to be a team approach. And this is a perspective from the treatment and prevention perspective. As you can tell, we're picking up speed and we're covering a lot of ground here. But an important discipline that's part of understanding this problem can be given to us from the treatment and prevention professionals. Bill Bergen will be speaking. He was born and raised, educated here in Buffalo, and has a master's degree from Buffalo State in Human Service Administration. He's licensed by New York State as an alcohol and substance abuse counselor and as a national addiction counselor. He is currently the executive director of Alcohol and Drug Dependency Services. Jody Altman graduated from Syracuse University in 1985 with a BA in psychology and received a MS, a master's in science, in 1987 in rehab counseling. Jody has 24 years of experience in the field of adolescent addictions, working at Bry Lynn, and since 1990 at Renaissance House. She has been a credentialed alcohol and substance abuse counselor since 1989. And last we have Yvonne Banks. She has worked in the field of alcohol and drug addiction for 19 years. Her clinical experience includes counseling adults in most levels of care, including outpatient, detox, inpatient rehabilitation, and community resident treatment settings. She holds a Bachelor of Science degree in Human Services, is a New York State credentialed alcohol and substance abuse counselor, and is certified in trauma counseling. Currently, Yvonne supervises 2 gender-specific community residences with alcohol and drug dependency services, sits on the Community Advisory Board for Stutzman Addiction Treatment Center, is vice president for the Association of Addiction Recovery Care Homes of New York, and is working towards a master's degree in interdisciplinary studies in human services. Please welcome our next presenters.
Good morning. I could never come up here as the executive director of ADS, or Alcohol and Drug Dependency Services, and think I could speak on the day-to-day operations that go on in our agency, whether that's the adolescent services or the adult services. And that's why both Jody and Yvonne are with me today, because they can give you a hands-on understanding of the impact of prescription drugs in a treatment setting. What I'm going to talk about a little bit is a call from the community and what's happened at Kids Escaping Drugs in 2007 and why face-to-face community education early intervention program exists today. In 2007, let me see if I can get this. Oh, there we go. In 2007, 6 area schools approached kids escaping drugs, and they had a problem. The problem was consistent. It was among all the schools, and they wanted help. They wanted a service that would better suit this problem. And how they presented was they realized there was a drug problem in their community. And that's a big leap for a lot of school districts or even schools to say that. They came to us and they said, can you help us? In Alcohol and Drug Dependency Services, Kids Escaping Drugs, we certainly never wanted to turn our back on any of our community members. If it wasn't for the community here in Western New York, we wouldn't be here. We wouldn't be successful. We wouldn't even be able to do things we do today if it wasn't for both the public and the private relationships we have. So certainly we listened to what their needs were. We wound up sitting down and trying to work out some type of model. And in 2008-2009 school year, we were able to introduce the program face-to-face. And we were able to introduce a couple different perspectives. One was a community education perspective. What we wanted to do was take our graduates from Renaissance Campus and have them talk to the people that were possibly at risk or individuals that we knew that may be introduced to drug use in these 6 area schools. So we recognize, as you heard earlier, that the average age of drug use is about 12 years old. We know, I should say, the average age of experimentation is 12 years old. We know that's the issue, so we try to target classes right around that age. And we had our graduates talk to these classes, and that was one of our approach, because they can talk to individuals about, if you're in this position or you're thinking about getting in this position, please understand what happened to me. Today you've heard both from Samantha and you heard from Dr. Rizzo. And you recognize that this can happen to anybody. This isn't something that occurs just in neighborhoods that, you know, of the impoverished neighborhoods or neighborhoods that just don't have resources. Certainly this can happen to anyone. You know, I get calls, I'll give you a small example of what happened about 3 weeks ago. I did speak on this in another event that happened on Meals on Wheels. I had a young woman be brought into my office, 21 years old. And she was with us because we have a detox service, as we call it, withdrawal and stabilization service. And she was afraid to withdraw because of the amount of drugs that she was taking, opiate prescription drugs. So she was brought in by a community member. We sat down, her mom, her, and this community member, and I asked her, how much are you using? And she started to cry. She asked her mother if she would please leave the room. So when her mother left the room, she looked at me and she says, I'm using 5 Oxy 80s a day and 5 Opana. And I guarantee you, for anybody in this room, a percentage of that dose would probably kill each and every one of us. She was 90 pounds, 21 years old. She said, you know, she said, sir, I'm from East Amherst, and this is an epidemic. What I said to her was, young lady, I think this is an epidemic in Western New York. And she said, sir, I'm from East Amherst, and you have no idea the size of this problem. All you see are the people that are walking in your front door, the people who want help. You have no idea. I have hundreds of friends out there that have no idea, that have no intention, I should say, of getting help. I've had 8 friends of mine in the last 2 years overdose. You know, as many stories as I've heard, and I've been doing this for over 20 years, I tried not to show surprise on my face, but certainly I don't think I did a good job of that. The one thing I can tell you, you know, although she didn't come into detox that day, she did 2 days later, and I know that she was discharged into a level of treatment, and hopefully today that she's doing very well, and my faith is with her. But what Face-to-Face has done within the last, I'd say, you know, you got to figure we started this in 2008, 2009. We started with 6 schools. Today, we're in over 70 schools. And not once did we ever say, you know, market ourselves to a school saying we want to be there. These are all word of mouth and calls coming back to the Kids Escaping Drugs office. It shows you the level of the epidemic that's going on. It shows you the seriousness of what's going on here in Western New York. And I know we heard from some national speakers here today, Director Kurlikowski. We also heard from our Attorney General. You know, and I know this problem exists everywhere else. But please, if you get the opportunity, you know, I'd like you to thank, if you ever have the chance, a couple writers for the Buffalo Evening News who came out with some stories back in March. If you had the opportunity to read any of our local newspaper, they've worked tirelessly at trying to provide a good picture of where we're at here in Western New York, and they did a wonderful job. 4 these writers did for the Buffalo Evening News. They wanted to present an accurate picture of what's going on. And that's really an accurate picture of our local data. You know, certainly we do have national data, but our local data was done, and I think it was over the period of 4 months of driving back and forth to Albany and doing the research here in local Western New York. So what I want to just also talk about is not only are we in over 70 schools today, but we provide another level of service called early intervention. We found a need to bring on a licensed social worker to do interventions with children that are at risk in the community, that could be referred to kids escaping drugs for reasons such as their parents have called up the school system, reported they found drugs in the household, or there's a tardiness in the parents that have recognized that there's a drug issue going on. And our early intervention system, done by our licensed social worker, Jessica Sherman, and supervised by Stacy Roeder, you know, what happens is our graduates are involved at the Renaissance campus. They meet with the child at risk and meet with the parents. And they tried to provide a structured setting where they can clearly identify if there's an issue. And up on the screen, you'll see that 199 early interventions were completed in 2010, and 97 referrals to treatment. Now, this isn't just the Renaissance campus they came to. They certainly could have had an early intervention and been referred to an outpatient setting. So I want to say that this wouldn't exist today. Face-to-face wouldn't exist today if there wasn't a significant problem here in Western New York. And I realize this problem is in other areas too. But I think that with all the people in the room here today, the public speakers that came up here, it emphasizes that this is a significant problem in Western New York, in New York State, and in the country as a whole.